If you are worried you have Lyme disease, or just like the outdoors, and want the peace of mind of knowing whether you have Lyme disease or not, there is a new Lyme screening test based on decades of research by Dr. Richard Marconi, a professor at VCU Medical Center. For more information, visit glymedx.com, that's glymedx.com, or email at info@glymedx.com.
Infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Hepatitis A has been in the news with some frequency as significant outbreaks have been reported in the Detroit area, San Diego, and Europe is experiencing a rather large outbreak. Joining me now to discuss hepatitis A is Amesh Adalja, MD. Dr. Adalja is a senior associate with the Johns Hopkins Center for Health Security. Dr. Adalja, welcome to the show, sir.
Thanks for having me.
Okay, well, hepatitis A is a highly infectious viral disease. However, there are some significant differences between this and the also common ones, hepatitis B and C. What are these differences?
Well, we have a whole basically alphabet soup of hepatitis viruses. There's hepatitis A, B, C, D, and E, actually. So hepatitis A is one that's primarily spread through what we say is the fecal-oral route. So you're basically getting it through something that's been contaminated by fecal material that has the virus in it, whereas hepatitis B and C are more bloodborne. For example, hepatitis B is something that people got with blood transfusions. It's also something that can be spread sexually. Hepatitis C is almost exclusively bloodborne, where we see such a major epidemic with the injection drug users. So they are all called hepatitis viruses, but they're all in different families, and they're spread differently. The thing to know about hepatitis A, it's the one that's spread through contaminated food and water.
Okay. And how common is this in the U.S.?
It was something that was very common. It was something that children got routinely, but it has become exceedingly rare because of the success of the hepatitis A vaccine. Back here, I don't know if you remember, in Pittsburgh around 2003, in the Pittsburgh area, we had the largest outbreak in the United States at a Mexican restaurant chain, which is now gone, called Chi-Chi's, where there was a lot of cases. So it was something that did happen sporadically, but the vaccine uptake has become so high that we're starting to see much less cases.
Right. What are the symptoms of hepatitis A and how long do they last?
So the symptoms usually include fever, chills, fatigue. People will hepatitis virus. People will start to get basically jaundice, so they may have yellow skin, the whites of their eyes may be yellow, their urine may be dark, their stool may become clay colored. They can have nausea, vomiting, abdominal pain. And the symptoms usually last, up to about less than 2 months usually. So it isn't something that's it is an acute illness, but it sometimes can have protracted symptoms. The interesting thing is, when kids get it, most of them are probably not even going to have any symptoms from it, but yet they're contagious.
And even if you're not showing symptoms, you're still contagious, right?
Right. Yeah, you can still shed the virus in your stool.
Sure. Okay. For many years, we have been waiting for a Lyme disease test that actually works. After decades of research by Dr. Richard Marconi, a professor at the Medical Center at Virginia Commonwealth University, a breakthrough test has been developed. The GLD test, recently launched by Global Lyme Diagnostics, is based on Dr. Marconi's science. For more information, visit glymedx.com, that's glymedx.com, or email them at info@glymedx.com. Okay, now in southeast Michigan, there's an outbreak. They've had about 190 cases and 10 deaths. And they report no common source of the outbreak, like contaminated food or water. And they say the transmission appears to be person to person through illicit drug use, sexual activity, and close contact among household members. Then if we look at the other side of the country in San Diego, the outbreak's been a little bit larger, about 228. and a good bulk of them have been hospitalized. And there's been 5 fatalities. And health officials are essentially saying that the homeless people and people using illicit drugs account for about 70% of the illnesses. And just over 1 in 5 also have hepatitis C, by the way. Now, this outbreak in Europe is pretty massive, and there's hundreds of cases, and it's mostly among unvaccinated men who had sex with men, or what we call MSM. Dr. Adalja, can you talk about these risk factors and others?
Yeah, sure. So hepatitis A does have kind of a group of risk factors that you often see common to cases. And the first, if you're talking about the United States, one of the things you might see is travel. So somebody may go to an area of the world where hepatitis A is more common, and then they may ingest contaminated food or water that has it. We also see men who have sex with men who may have fecal oral contact that could cause the virus to transmit. So that's another high risk group. Injection drug users can also be a risk group. They can share needles, and the virus can be, although it's mostly a fecal oral transmission. If it's in the bloodstream and you're injecting directly in from a contaminated needle, that's another way that you could get it. People who are around certain animals that may have the disease as well. So there's kind of a general conglomeration of risk factors that you can often find in any outbreak setting.
Any significance to the point they made in San Diego that about 20% of them also have hepatitis C?
It is important because when you have hepatitis C and then you get a super infection with hepatitis A or vice versa, or any other hepatitis virus, hepatitis B or C, and then you get a super infection with hepatitis A, that can lead to really fulminant disease where you can have severe symptoms and may die because of the combination of the two viruses basically acting synergistically to destroy your liver.
Yeah, and this virus is the viral disease is typically considered a mild disease, but we do see quite a few deaths between Detroit and San Diego. Does that seem high to you?
It's hard to say exactly because we know that while most cases are mild, we don't know that much about the case histories of these patients. How many of them have hepatitis C? How many of them have hepatitis B? How many of them have alcoholic liver disease? How many of them have diabetes? How many of them have how old are they? All of these types of factors can play into how well they might tolerate a hepatitis A infection. Mm-hmm. So obviously, in uncomplicated cases, it may be you may have a couple months of really bad symptoms, but you don't die. But we don't know exactly what else is going on, what the comorbidities are in these patients. So that may explain the mortality numbers that we're seeing. Sure.
Now, because this is a virus, there's no specific treatment. However, there is a vaccine to prevent it. I think it was launched in 1995. Dr. Adalja, what can you tell us about the vaccine?
It's a very effective vaccine, and now it's become something that's part of the routine childhood immunization in the United States. So all children are now, if they're following the vaccine guidance as they should be, they would be getting vaccinated against hepatitis A, and it's a 2-dose regimen. There's even a combination vaccine now that has hepatitis B and A in it at the same time. So this is something that really has revolutionized the rates of hepatitis A in the United States and made it something that has become very, very rare.
And this is a vaccine that, of course, you would recommend for travelers going to Mexico and countries like that.
Yeah, it's important if you're traveling to any country to look at the CDC travel website and see which vaccines are recommended. But although some people may have gotten hepatitis A as a child and then they don't necessarily they may not need the vaccine, but there are regimens that you should take if you are going to an area and you're not immune. And not just the vaccine. Some people, if they're going really quick, have to get the immune globulin, which is the antibody to give them fast protection in those areas. I was somebody who got the hepatitis A vaccine as a traveler when I was about 22.
Okay. Now, though we're seeing these outbreaks in San Diego and the Detroit area, overall, has the introduction of the vaccine in the U.S. Reduced the number of cases in this country and in other countries?
Yes, significantly. Anywhere you see this vaccine being used, you see a real decrement in the number of cases, and we've seen hepatitis A cases fall substantially. If you look even at the CDC graphs, it basically drops off substantially as soon as the vaccine reaches high enough levels. So it is something that the numbers are there's probably some underreporting, but the numbers are not very high anymore in the United States. They estimate about 2,500 cases. Based on what they think is being underreported in the number of reported cases.
Yeah. Is there anything else you'd like to add?
I think it's important that people realize that hepatitis A is a contagious infectious disease, and it's not something to worry about so long as you've been vaccinated. But in those adults who may not have been infected as children, it is something that you have to think about your risk factors for. And injection drug use is one that can spread it, as well as contaminated food. But it is something, hopefully, that they'll get a handle on, because we have an effective vaccine and we have the ability to actually intervene to stop these outbreaks in the United States.
Excellent. Okay. Thank you again, Dr. Amesh Adalja, for your time and expertise. I appreciate it.
Thanks for having me.